Hey, happy Monday. It's a little bit after noon. This is going to be a new segment that I do a couple of times a week. It's called Awareness with Andrea. I'm going to be going over articles on health and life and parenting and recipes and cooking and basically anything that I find interesting that maybe you'll find interesting too. Hey, Steph. So today's the first installment brought to you by the letter A for awareness and Andrea. So we're going to talk about melatonin in children. I have an article here from drmercola.com. He talks about how too many children are taking melatonin, and we're going to go over it. I imagine I'll be talking for about 10 minutes, and if you have any questions, pop them in the chat box. So basically, melatonin is a hormone created by the pineal gland. It is secreted when it starts to get dark. It helps you make you sleepy. And it's secreted when it starts to get dark. It makes you sleepy. It's good for about 12 hours. And then as you're starting to wake up, your secretion of melatonin decreases dramatically. And melatonin is part of the circadian rhythm, our natural rhythms that our bodies go through every 24 hours. So, occasional melatonin supplementation in children is just fine, but what happens is parents will start to rely on melatonin more and more and more. And often the melatonin supplements out there, they have 3 milligrams of melatonin in it, which is quite a bit, certainly much more than a child's body would naturally produce. So I'm going to kind of read through the article and then discuss it with you guys, okay? So one of melatonin's primary roles is regulating your circadian rhythm, as I already mentioned. When it gets dark, your brain starts secreting melatonin typically around 9 or 10 p.m., and it makes you sleepy. Levels typically stay elevated for about 12 hours, and then as the sun rises, your pineal gland reduces the production, and all of the levels in your blood decrease until they're basically not measurable at all during the day. Now, when circadian rhythms are disrupted, like shift workers or jet lag, then melatonin is going to decrease, of course, because your body's not getting the normal day and night cycles, especially if you're a shift worker. You know, you're working in a hospital or something under artificial lights from 11 p.m. until, whenever in the morning. My cousin's daughter, Jessica, she does this. So Jessica, if you're watching, pay attention. Anyway, in those instances, supplementing with melatonin can be super, super useful. Now, sometimes children don't sleep well, whether that's because of a medical issue or maybe something behavioral going on or, challenges at school, whatever. And melatonin can be useful there. It's certainly much safer than sleep aids. Now, one of the things he says, Mercola, is that one example would be children with autism, for whom sleep disorders are common and may intensify autistic symptoms. Melatonin has been found to help synchronize circadian rhythms and improve sleep quality and behavior in individuals with autism. Among children with ADHD and chronic sleep onset insomnia, melatonin was also found to be an effective therapy in 88% of cases, even when used long-term with no serious adverse events reported. Further behavior and mood also improved 71% and 61% in those cases, respectively. So if your child is dealing with some sort of a neurodevelopmental challenge, and I think a lot of you guys know I do work with that in the office, melatonin supplementation can help and doesn't necessarily have any long-term effects. However, for children who are otherwise healthy but struggle with bedtime on occasion, melatonin should be used with caution, if at all. Most pediatricians know little about sleep or melatonin. For non-autistic children, it is a fashionable treatment for parents wanting perfect children, said Dr. Neil Stanley, former director of sleep research at the University of Surrey. Now, melatonin is thought to be relatively safe when used for short or medium-term periods. Medium term is defined as up to 18 months. I'm going to tell you, I still think that's way too long. Some children are taking the supplement like for 6 or 7 years. So they start when they're a toddler, and then at the age of 7 or 8, they're still taking it. That's way too long. One of the things that I always say is your body is very, very smart. Like if it's supposed to be generating something and you're giving it to the body is going to be like, okay, well, I don't need to generate it because you're giving it to me exogenously or externally. So it will decrease the normal production. So with melatonin, if you're supplementing melatonin on a regular enough basis, your body is going to decrease its natural production of melatonin, which then creates this vicious cycle of your body's not creating melatonin, so you can't sleep. So your body, you take melatonin, your body doesn't create melatonin, blah, blah, blah. one of the things that one study that was done on melatonin basically says very little systematic research has been done into the possible impact of melatonin intake on puberty and the endocrine system. Now, the endocrine system obviously is all of your hormones, and that doesn't mean just your sex hormones. It means everything: melatonin, glucagon, insulin, blah blah blah. Treatment with melatonin in children with ADHD and chronic sleep onset insomnia is best reserved for children with persistent insomnia, and that is having a severe impact on daily functioning. Now, let's talk about proper sleep hygiene. So if your child is not sleeping well, you might be tempted to put them on melatonin, but let's talk about proper sleep hygiene first, because that really is the first thing that you should look at. And we need to understand that sunlight is crucial to melatonin production. It's crucial to all of your circadian rhythms. So if your child isn't sleeping well at night, the very first thing I would say is make sure they're getting enough sunlight in the morning. And sunlight in the morning is going to be better than sunlight in the afternoon. So, when you wake your child up in the morning, throw open those windows, let the sunlight come in, maybe even get them outside for 5 to 10 minutes before breakfast, just to let the sunlight get on and into their eyes, into their brain, so their body knows, okay, it's daytime, like this is a circadian rhythm, right? Napping during the day should be avoided. This obviously is going to be after a child is a certain age, because if you've ever had a cranky 2-year-old, you know that you need to give them a nap so you don't kill them. No, I'm kidding. Dinner time also, make sure it's not too close to bedtime. Like in my family, we tend to eat late, but my kids are older. My youngest stepdaughter is 11 and the oldest just turned 18. So they're teenagers, close to adults. If you have little kids though, eat dinner a little bit early and make sure there's at least 2 to 3 hours before they go to bed. Screen time. This is a huge one. Screen time for kids is really affecting their neurodevelopment. It's affecting how their brain is growing and developing. Screen time should be discontinued at least 1 hour before bedtime for children. That's, as far as I'm concerned, any child. So it doesn't matter if they're 13 or it doesn't matter if they're 6. Screen time just before bed, those blue lights that come off the screen really do impact that melatonin production. Bedtime routines are very, very important. Sleep and wake up time should be maintained if you can, even on the weekends. It's a little bit harder when they're older. Like my kids now like to, read until 1 in the morning or whatever, and that's fine. Co-sleeping. Let's talk about this a little bit. Co-sleeping is good when they're little, but once they get to be a little bit older, it starts to run into issues with both mom and child getting enough sleep. Now, you guys do whatever you want in your family, but I just want you to look at sleep hygiene and how well everyone in the family is sleeping. If everyone's getting a good night's sleep and you're co-sleeping, more power to you. But if mom and dad are not rested and the kid is not rested, then maybe co-sleeping, maybe it's time to get them into their own bed, just because it does help create that better sleep hygiene so that you can get good rest. In terms of the room, I'm not a fan of night lights in children's rooms. It does keep it a little bit too bright. And although most kids can sleep through anything, it's really not good for them in terms of their neurology. So the rule of thumb is there should be enough light in your bedroom to see your hand in front of your face. I'm sorry, I said that wrong. If there is enough light in your bedroom so you can see your hand in front of your face, it's too bright. So, try to get it dark and keep it cool. Better to put them in a onesie or a good blanket than to have it too warm. Okay, so here are some sleep tips from fellow parents, okay? This is in an article posted on Growing Slower. One mom shared what finally helped her toddler get a good night's sleep, and it involved a long process of trial and error to find the right combination of tricks that worked for their family. Among them was organic cotton sleepwear instead of synthetic fabrics. That can make a difference. Organic cotton is very, very soft. Synthetic fabrics can feel a little bit pokey. Immune system support in the form of vitamin D and omega-3 fats. Vitamin D is crucial. I'm telling you, even in Southern California, every time I get my vitamin D checked, it's a little bit low. So we put on sunscreen. We don't go out in the sun anymore. Vitamin D is very important for your overall immune system. Omega-3 fats are really good for your brain. So those two things, make sure your child is getting enough of them. Vitamin D is synthesized from the sun, but if your child is not getting enough sun time, and we're all afraid of skin cancer, then make sure you're supplementing with a good absorbable vitamin D. Vitamin D is a fat-soluble vitamin too, so you want to make sure you're taking it with a little bit of fat so it does get absorbed in. A teaspoon of coconut oil before bed, it can help keep them feeling full so they don't wake up kind of hungry. Epsom salts prior to bed is really good. Epsom salts are high in magnesium. Magnesium helps people rest better, and it is absorbed in through the skin. Now, this also says magnesium oil massaged under the belly before bedtime. I will tell you, I don't think that's a fantastic idea for kids because magnesium oil can make you feel itchy. So when I use it, like my legs, I'm scrubbing them and scratching them because the magnesium oil is itchy. So just be aware of that with children. I prefer the Epsom salt baths to the magnesium oil, but magnesium oil is good for adults. White noise can be helpful. And then also, I already mentioned this, a good bedtime routine. So how can you boost your child's metabolism? How can you boost your child's melatonin naturally? Sunshine during the morning. I've already mentioned that. Get at least 15 minutes of sunlight in the morning hours. Make sure you're sleeping in the dark. We already talked about that. You shouldn't be able to see your hands in front of your face. Screen time. Turn off electronics and handheld devices 1 hour before bedtime. If your child is drinking soda, Coke, Pepsi, things with caffeine, Mountain Dew, you might want to make sure that that doesn't get drunk after noon. Frankly, it's not good for your kid, but if you're going to do it like before noon. And then stress and cortisol. I'm part of a conference. We're going to be speaking at Cal State Northridge in March or April. And we had a meeting last night. And one of the women who was there is a teacher. And she was saying that children as young as kindergartners are stressed. They feel pressure to perform. They feel like if they don't do perfect on things, their parents are going to be upset. So lowering your child's stress level is important. It's a little weird to me that I even need to say that because I feel like if you're 5, the only thing you should be worrying about is which Barbie doll to ask for Christmas. But apparently these kids are super stressed out and they have a lot of they have a lot of pressure to perform. So if you're one of those people who's maybe asking a lot of your kids and not giving them enough downtime, take a look at that because those cortisol and adrenaline surges are going to affect their sleep as well. All right, so that's it. That's Awareness with Andrea, episode 1. I'll be back on Wednesday, and I'm going to do this probably twice a week, maybe 3 times. We'll see how it goes. If you have any questions, shoot it in the chat box, and I'll see you later. Have a good one. Bye.